I chose to do my discussion for week 4 on genital herpes. It's a sexually transmitted infection caused by the herpes simplex virus, also known as HSV. There are two different types of HSV. HSV1 is the type of herpes that people get on their lips, and most people call that a cold sore. But a lot of people don't know is that herpes simplex 1 on the lips can cause genital herpes if you have a cold sore on your mouth and scratch it and go to wipe yourself in the bathroom, or if you have oral sex and you have a cold sore, you can transmit it, and then it becomes HS2, which is the most common cause of genital herpes. Genital herpes is a very distinct sexually transmitted infection. It is known to be very painful. The person ends up with lots of blisters, ulcers, sores on the genital area. It is, they describe it as itchy, just a very uncomfortable, painful infection. And this virus can be spread even when sores are not present. They call it asymptomatic shedding. Once you are infected, you are always infected. It remains in your body for life, and stress can trigger the outbreaks. An outbreak is what they call it when a person has active genital herpes sores. For incidence and prevalence, what I found doing my research in comparing two separate populations of men versus women from ages from teens all the way to the age of 50 is that is more prevalent in the United States in women. Women have a 15.9% higher chance of getting HSV2 than men. Men have an 8.2% chance, which is wild because you would think that I would think men are more promiscuous than women, but who am I? It states that women have a potentially higher cumulative incidence over time. And I don't really know why that is. It doesn't really delve into that from the research that I conducted. The CDC states it could be due to several biological factors that are related to transmission. Like women, we hold moisture down there. Men don't. We got a couple more holes than men. I don't know why it is. But HSV2 is definitely more prevalent in women. Some legal and ethical implications for nurses is confidentiality. Number one, HIPAA. HIPAA is the most important thing regarding like ethical and legal responsibilities as far as the nurse is concerned. It is not our place to go and inform the patient's partners or parents or anything like that when they have been diagnosed with a STI. However, certain STIs we are bound by law to report to DHEC. But genital herpes is on that list of mandatory public health reporting. But we do not have to notify their partner directly. That's not one of the STIs that requires. That's more like HIV, Hep C type of STIs. I guess that's because herpes can't kill you, even though it can cause a lot of other damage. It's important that we as nurses understand that we must provide care regardless of a patient's STI status. We just have to take extra precautions to use the PPE that is afforded to us that we know that we should be using. We have to have informed consent, make sure that the patient understands whatever the treatment that we're doing, make sure that they understand that we might have to look or even examine down there in the private areas so that they have that they make informed decisions and give informed consent before we begin to diagnose, treat, anything like that. We have to make sure we educate and counsel the patients and make sure we absolutely inform the health department about whatever kind of STI that is associated with the patient that needs to be reported. So the AACN essential that I found most helpful or most relatable to this discussion board was the assessing and documenting patient information, electronic health records, where nurses, we are using we're accessing their information, and we're making sure that we are closing out of the computers and everything like that, making sure we're keeping their privacy, their private health information private. That's about it.